So we have the University of North Carolina probe right here, or better known as the UNC12 probe. So on this instrument we have the handle here, then we have the shank here, and we have the working end right there. This instrument is for chart probing depths, recording signs of inflammation like bleeding. It's also used to measure clinical assessments such as recession, lesions, or mobility. So we can see here on the instrument that there are numerous lines here, and each of these represent a measurement. So the two dark ones here, the first dark one represents about 4 to 5 millimeters, and then the second one represents 9 to 10 millimeters. And as soon as you enter this instrument into the sulcus, and you pass the first line right down here, it is 2 millimeters, and so on and so forth. This instrument is one of the dental hygienist's most important instrument because it's used to determine the condition of the patient's gums, and it helps also determine what type of cleanings the patient will need in the future. And when the treatment is planned, it also helps us measure the success of each appointment. Let's say the patient got any dental surgery done recently, such as implants or bone grafting. So times like this instrument is forbidden to use because it can actually push down any bacteria around the area deeper into the gums of the already worked area. So that puts the patient and the implant at a risk for the body to accept the implant. But on the contrary, there is another special probe that is used when you wouldn't use this for the specific implants, and it's called a PP12. So when actual probing, you split the tooth into 6 parts. So we have 3 on the facial or buccal, and then 3 on the lingual or palatal. And the 3 parts break up as so. So we have the distal side here, the facial side here, and then the mesial side, and it's the same for the lingual side. So when you're going in to actually get your recording, you want to start off at the distal line angle of each tooth. So let's say we're doing the central incisor right here. We are going to start off here, and we want to make sure that our instrument is parallel to the long axis of the tooth. And what that means is that the instrument should be pointing to the apex of the tooth's root. And as I'm going around the gingiva, I want to make sure that I do a walking method, which I will show in a second. And another thing I also want to make sure is that as I'm going around each tooth, the instrument is also adapting correctly. So we have the gingival margin right here, and when the probe is inserting into the gingiva, it's going to stop all the way down to the junctional epithelium. The working order also goes from 1 to 16, and then that's for the buccal side. And when you're coming around to do the lingual side, you go from 16 to 1. And the same for the bottom. You would start off at 32 to 17 for the buccal, and then for the lingual, you would go from 17 to 32. So when I am looking for the measurement, I want to record the deepest one for each section. So let's say it is for this facial side. Let's say I get a 2 here, but then I get a 3 here as I'm walking down. I would record down 3. So I'm going to start off on quadrant 1, and I'm going to be working on this premolar and canine. So in this case, it's tooth number 5 and 6. So like I said before, I'm going to start off at the DLA, distal line angle, and work my way distally. And then I'm going to pull out and work my way mesially. So again, start off the distal line angle and move my way mesially. And now I will do the same for my linguals for each tooth as well. So now moving on to quad 2, I will work on teeth number 9 and 10. Like I said before, the working end is from 1 to 16 for the buccal region, and then from 16 back to 1 for the lingual side, as I'm showing here. And then again, just move on to the lingual side and do the same. And now for quad 3. Also keep in mind that the working end on the mandible is 32-17 buccal and then 17-32 lingual. Same for lingual. And now for quad 4, we're going to work on this molar and premolar, teeth number 30 and 29. So the linguals on quad 4 is always challenging to show, but with the help of my little sister, I was able to get a better view and show you guys that I'm working again on the molar, the distal line angle, work distally, come out, and then work my way mesially for each tooth.